Hi friends, this is Ashima and welcome to Reconnecting Kids. In today's episode, I'm going to be covering one very important area or a subtopic. This is the question I get asked the most often. This is the question asked by prospective parents. This is the question asked by parents who are planning another child. If the first child was on the spectrum or had any other developmental delay or behavioral disorder, this is the question I get asked the most. And the question is, what are the kind of precautions that we should take to ensure that now that we are planning another child, he doesn't have these developmental or behavioral disorders or delays? What can we do proactively? And it is an excellent question, because as we have been discussing this, that these disorders, including autism, ADHD, these are not neurological disorders. They are not only just genetic disorders either. These disorders are caused by an amalgamation, of course, of your genetic load, that we know that some of us cannot detox well, but also the environmental overload of toxins that we really introduce our children, unborn children, small children with. These are the reasons that contribute to this disorder. Now that we have this knowledge, it is really important, and I really appreciate parents who are being proactive in ensuring that they can avoid this with their future children. I'm going to be talking about one of those factors, which is the silver fillings. Yes, you heard that right. Silver fillings were very common for filling dental cavities up until I think 10 years ago. They were really common. What most of us do not know, in fact, that the amalgams filling is also what it's called. One of the metals that really became a part of that amalgam is mercury. Yes, you heard that right, mercury. Mercury is a heavy metal, but is also is used in so many of these fillings, amalgams, silver fillings, and it is put inside our teeth to fill these cavities. What happens is that this mercury then leaches out and it affects our body, and then people who are not able to detox well, it continues to stay within their body. It moves around their body. In fact, I was reading a report recently where they really saw that mercury and aluminium both have traveled the body of a subject from lymph nodes to the brain, and it continued to stay there. It did not get detoxed easily, and it continues to cause a lot of problems. In fact, the gut bacteria, the gut fungi, the gut viruses actually see these heavy metals, including mercury, and use this as a shield. So they really house within these metals actually, and it becomes really difficult to then detox them or use any antimicrobial, because this acts almost like a biofilm around them. It's almost like a strong covering around them. And that is the reason why it is so difficult to really deal with it. Well, a precautionary way or a proactive way to really avoid this would be to really plan this ahead, of course, as most of you parents are now doing. I would say, if you have silver fillings already there and you're planning a child, get these removed. Okay, get these removed and get any other ceramic or any other kind of filling done in place of this. However, very important is that when you're getting this removed, go to a holistic practitioner. Okay, there is an organization called IAOMT. Okay, it's an International Academy of Oral Medicine and Toxicology. It's an international organization. However, in India, a lot of universities, a lot of doctors are also affiliated to it. They follow those practices. I have spoken to professors in Maulana Azad Medical College. I have spoken to 2 doctors there, and they are well versed, and they would recommend also more physicians. I will also leave a number of few people who you can get in touch with. Now, you must be, if you're curious like me, you must be wondering, what is the difference between these practitioners? What do they do differently than your local dentist, for example? Well, IAOMT is an organization, and it actually lists out procedures, it lists out processes, holistic processes by which you can avoid this mercury fumes to be inhaled. Okay, once you're removing this filling, this silver filling with mercury in it, there are chances that you would be inhaling this back, which will of course prove to be toxic, which can make you even more sick or sick in the first place. That is the reason they use certain shields, they use covers, they take all the precautions that they need to take within the environment that they are treating you, so that this doesn't get reabsorbed. And that is the reason that you need to go to a holistic practitioner like that, so that they can remove it safely. And it is advisable that you do that before you plan a child, and this applies to both mother and father. It is not just that the mother shouldn't have a silver filling and a prospective father is okay with that. It is not. It is also not seen in research that the sperms also have traces of mercury, which they can pass on to the prospective child. So both mother and father, if you have silver fillings in your teeth, get those removed from an IoT affiliated practitioner before you plan a child for your child. If you are an expectant mother and you already have fillings with you, it wouldn't be recommended that you go through this dental treatment during pregnancy, frankly. You need to wait out, and post-delivery you could look at getting this removed, but I would highly advise this to get through this procedure before you're planning your next child, so that you can really avoid this exposure. There are really research confirming. In fact, the protocol advised by Andrew Hall Cutler, which involves low-dose oral chelation, actually has helped thousands and thousands of children in reversing their autism symptoms, actually. And you could read about this procedure as well. We will be doing an episode on this, and you can do this in consultation with your doctor. And this procedure is really laid out very beautifully in his book, and you could read about that, and you could get your doctor on board, the doctor that you're working with, and you could start on that route as well. I hope you found today's episode to be useful. Please do write to me your comments, your own stories, your own experience with mercury toxicity and what you have seen so far. Till we meet again, goodbye.